We're going to be checking in with Bridget again. This time she is headed to Alvarado Hospital for an exclusive story that she's working on.
You're watching Good Morning San Diego.
Welcome to Monday, everybody. Prescription drug abuse has been rising fast in the United States.
Yeah, some new numbers are out from the National Drug Control Policy, and it's really mind-boggling. Bridget is here to join us how, prescription painkillers have really taken over for almost a lot of the other drugs that used to be a problem. Now these are becoming even bigger problem.
They have, Dan and Sandra. It has grown astronomically. Just to give you an idea, last year, 305,000 people across the nation were admitted to emergency rooms because of overdoses from prescription medications. They are dangerous drugs if not used properly. And this morning, we're getting educated about this rise in the number of people checking into hospitals because of this or ending up here. Anyway, from a couple of folks here, we have Dr. Kevin Kelly. He's the director of the emergency room here at Alvarado Hospital. And Will Jones is with the East County Regional Recovery Center, and you treat people with drug addiction problems. Thank you both for being here with us this morning. First of all, doctor, what are you seeing in emergency rooms, this one in particular?
Bridget, we're definitely seeing a rise in complications from drug abuse, prescription drug abuse. We're seeing a rise in the people actually coming to the emergency department seeking those drugs. And the real tragedy is when people overdose and it becomes a life-threatening problem.
Yeah, you're talking about, a lot of young people too. Teenagers are getting their hands on these drugs. What are the dangers of taking a drug, too much of a drug like this, especially if this is not prescribed for you?
Well, the problem is a teenager will find a drug in the cabinet and say, well, mom was prescribed this medication, so it's probably pretty safe. They take the drug, mix it with another drug that one of their friends might have. Those work synergistically. They take it with alcohol, and all of a sudden they stop breathing.
That's what you see here in the emergency room. Tell me about what you see when people come in. What are the complications?
Well, as I've said, overdose can be a real tragedy. That's a life-threatening event. When a person stops breathing, their brain is denied oxygen and they can die. And sometimes we'll see the kids come in this way. And it's on the rise. It's a real danger. Parents need to be aware of where their medications are, keep them locked up, educate their kids about the dangers of these medications, and certainly mixing these medications with other drugs or alcohol.
And just name a couple of drugs for me.
These are Percocet and Vicodin and Soma. And those work synergistically with alcohol to create complications.
We're talking about 1,000 deaths of teenagers in San Diego County last year. Will, tell me about this problem. Why are these the drug of choice for young people and people in general, and how do they get their hands on them?
Well, the drugs are easily accessible to the kids. And today it's like, I would say more people are leaning towards prescription medication because of the easy access to the drug and medication.
They can just get it out of the medicine cabinet.
Get it out the medicine cabinet, get it from a friend. We've had people come into treatment that got addicted to medication because of friends. They start off with their friends and, things like that.
So what do you see in your treatment program?
Well, we're seeing a rise of numbers with, I would say between the ages of 19 and 25 is really starting to become an epidemic in that area. And today it's like, where did this come from?
Right. What advice would you give to parents or someone who knows someone who they think might be abusing these types of medications?
Well, I would first of all ask the parent to contact our center or any treatment facility, find out the proper procedure. And I would think the first thing to do is talk to the kid. Ask the kid, just direct. Ask the kid, is there a problem? And if so, let's get you some help.
I know you have an event coming up in August. Just quickly tell us about that. We'll have a link on our website, KUSI.com, for more information. But you want to get the word out about the problem.
That's true. And we have a prevention summit that's coming up, sponsored actually by the County of San Diego. And so that would be in mid-August. And so it'll be on the website. And
we'll put a link on our website, KUSI.com, to your website. We'll appreciate talking to you as well. Dr. Kelly, thank you so much. Once again, we want to get information out, let parents and people be aware of the situation. So once again, they don't have to face the unfortunate situation of rushing to this emergency room to check up on a teenager or someone that they love that may have overdosed on this medication. As you can hear, this is a huge growing problem. And we want to get the word out and hopefully put a stop to it. Back to you in the studio, Dan and Sandra.
Yeah, I know in the county, the district attorney's office and some of the other agencies have every now and then, a time when people can bring their extra prescription drugs and discard them. And that is one good way to get them off the streets or out of the home so you don't run into this problem.
You're right. That's a new program that the county just started because prior to that, people didn't know what to do with their old medication. You're not supposed to flush it down the toilet. You're not supposed to just simply throw it in the trash because people will dig through the trash to get it. So, yeah, there is a new program. If you go to the county website, you can find out more information on that. A great point, Sandra.
All right, Bridget, thank you.
Thanks, Bridget.
See you later.